Today marks 1 year since the World Health Organization declared the coronavirus a pandemic. No place in the U.S. felt its immediate impact more severely than New York State. Thousands of residents in the city of New Rochelle experienced the country's first full lockdown. Health officials had declared the New York City suburb a so-called containment zone, shutting businesses and schools. At that point, just 31 people had died from the virus in the U.S. Then the widespread closures began. Governor Andrew Cuomo canceled the city's famed St. Patrick's Day parade. Broadway went dark. The Big East tournament at Madison Square Garden banned fans. Then officials ended the entire tournament in the middle of a game. The city began intense cleaning in the subway as New Yorkers started to mask up. Streets emptied as offices closed, including our home at the CBS Broadcast Center in Midtown Manhattan. Health workers in state hospitals scrambled to figure out how to help the exploding number of infected patients. Since then, more than 48,000 New Yorkers have died from COVID-19. 1.7 million people in New York had a confirmed infection. Now, just over 10% of the state's population has been fully vaccinated. Dr. Stephen Corwin is president and CEO of New York-Presbyterian Hospital. He joins me now from New York City to discuss. Dr. Corwin, welcome. Great to have you with us.
Thanks, Tanya.
Take us back to this time last year. As New York began to shut down, the pandemic was still a very unknown thing. What was it like for the hundreds of doctors and nurses under your direction? What memories specifically stick out to you?
Let me just give you a couple of numbers. March 8th, of our 3,600 medical surgical beds, we had 4 COVID cases. By March 15th, it was 66. By March 23rd, it was 590. And by March 28th, it was over 1,600 patients, reaching a peak of 2,600. We knew as soon as our first case, which was the lawyer from New Rochelle, was hospitalized at our Westchester Hospital, Lawrence Hospital, that we were in for a troubling time, that this was going to look like Wuhan or Milan because of the fact that we had community spread that heretofore we hadn't recognized. So we really started to think very heavily about exactly how we were going to make sure this all occurred. By this time last year, exactly this week, we stopped all elective surgeries. We started to redeploy our physicians and nurses. We started to make sure that we could be prepared for an onslaught of cases in our emergency departments and ICUs. But I recall vividly, to your point, Dr. Laura Faris, who's our chief operating officer, calling some people very high up in the Archdiocese saying, "You sure you want to do the St. Patrick's Day parade?" And of course, as you mentioned in your introductory piece, that was canceled. And you could see eerily at that time that New York was bracing for something that was going to be very bad. I could never have anticipated how bad it was. And look, we're still in the midst of this, as you said before.
We are. And of course, your hospital is ranked one of the top in the country. And while the coronavirus hit everywhere, the city's public hospitals, such as in Elmhurst, Queens, which is less than 10 miles away, were inundated with patients for months. As an executive, what has this pandemic taught you about the economic and racial gaps in healthcare and how prepared we are now for a similar pandemic that may be a couple years down the road?
Well, as you pointed out, it's horrific. We saw more cases than the public hospitals did during the course of the pandemic. We have a hospital in Queens that was equally inundated, so I'm very familiar with how troubling this was because we have hospitals in Brooklyn and in Queens, Manhattan, Westchester. So what I would say, Tanya, is the following. Businesses in general, and certainly hospitals, got to the point of being as efficient as we possibly could, just-in-time facilities. Now we've got to be just-in-case facilities. We've got to build up our ability to predict these outbreaks. We're hiring people now who are experts in pandemics and experts really in appreciating when a pandemic can occur. People who've had experience with Ebola, people who had experience with unusual pneumonia outbreaks in China, of course, which this was, because you have to be able to do predictive analytics. But we need more reserve in the system, more reserve in terms of protective equipment. We saw the fragility of that supply chain, more reserve in terms of ICU beds. We saw the necessity for ICU beds, more reserve in terms of cross-training all of our employees as we redeploy them. So you have to rethink exactly how a hospital has to function. And we're well on the way towards doing that.
And of course, Doctor, you are a cardiologist by trade. We've seen evidence of the impact COVID-19 has on heart health, but there's still so much we don't know about the long-term effects of this virus in people who have recovered, or at least seemingly recovered. What concerns do you have, given just how many Americans have been infected and how much we still have to learn about this virus?
Well, we just published a study from our Columbia facility showing that the long-term effect on athletes in terms of their heart health is not high. So that's good news. But you have these long-haul COVID patients with long-term neurologic findings, long-term inflammatory findings. So this is a virus we still don't understand fully. Everyone's hope was, well, this will become like the common cold. Well, we don't know that. And everyone's hope is that everyone's initial thought was that the mutations of this virus would be relatively slow in coming. We now know that that's not the case. So what I would urge us, as the president is urging, let's not spike the ball at the 5-yard line here. Let's make sure everyone gets vaccinated, everyone uses their masks, continue to practice social distancing, be careful about where you go, be careful about how you travel until everybody gets vaccinated.
But are you confident we've turned a corner? It sort of feels that way, and I'm hoping that you would agree.
I do, and I don't mean, there's so much doom and gloom around. I don't want people to feel doom and gloom. I want people to feel that we clearly are at the beginning of the end, but we're not at the end. And that's what I meant by spiking the ball at the 5-yard line. Let's cross the goal line here as a country and support each other. Get the vaccinations in. Really get to the point where we've suppressed the virus so low that if it comes back in the fall, it'll be less noxious. Suppress the virus so that dangerous mutations don't continue to evolve. So I'm very optimistic. I'm very optimistic with the passage of the American Rescue Plan, because as you pointed out, what we saw in this pandemic was disparate mortalities depending on the color of your skin or your socioeconomic condition, your housing capabilities, your food security. And I think that it's important for us to recognize that health is not only dependent upon what your genetics are, it's dependent upon the social determinants that surround you. And I think that the American Rescue Plan will help many people who really do need the help, and especially our children.
Well, Dr. Stephen Corwin, thank you so much for joining us. We appreciate your time.
Thank you.